Hi. So let us discuss a common but often unaddressed problem in females, that is the problem of urinary incontinence, which is in common terms means leakage of urine which is sudden and unexpected. Firstly, I would say that leakage of urine is itself not a disease, but it's a symptom of a disease. And number two, this is easily treatable condition, and as usually I have seen most ladies thinking that it's a part of aging and nothing can be done about it. That's absolutely wrong. We can very well correct it with medicines or with other techniques. Firstly, we need to categorize the type of leakage, because the treatment depends on this categorization. So there are two types of leakage. One is called as stress incontinence, another is called as urge incontinence. Stress incontinence does not mean that person has a lot of stress. It means that when some pressure is generated inside the abdomen, like coughing, sneezing, or laughing. So these things put a pressure on the bladder, and as the pressure increases, there is some leakage of urine. Till the time there is no leakage. So now how to treat it? First and foremost is pelvic floor muscle exercises. These are some exercises which come by the name of Kegel's exercises, which are trained to the patient so as to strengthen this pelvic floor which has become weak. Number two is weight reduction. If the patient is obese, reducing some weight and getting into the optimal weight will help in solving the problem. In some cases, some mechanical device can be used in supporting the urinary passage, supporting the urethra, so that leakage is not there. And if everything fails, then there are some simple surgeries which are called as sling surgeries, in which a tape is placed to support this urinary passage so that it can hold when the abdominal pressure increases. These surgeries are simple day care or one day stay surgeries without any blood loss, and patient is back to his activity within a few days time. The another cause for incontinence, leakage of urine, is urge incontinence. This means that patient is sitting comfortably at a place, but suddenly there is some leakage of few drops of urine or lot of urine. So why does it happen? It is because mostly there is some intrinsic abnormality with the bladder wall. So it becomes overactive. It doesn't hold urine for long, and when some little amount of urine comes into the bladder, it just pushes the urine out. There can be some other conditions also which can lead to, like infection of the urinary tract, bladder, or when because of use of some irritants inside the bladder, which can aggravate this problem. So how to treat this condition? It means a lot of lifestyle changes, like cutting down on fluid intake. Don't take too much of fluid in a short period of time. Regulating the water intake, liquid intake. Also some exercises, bladder exercises. Then there can be cutting down on the irritants of the bladder, like caffeine, like cold drinks, like spicy foods. Also, there are various medicines which can be prescribed to decrease this urge incontinence, to increase the bladder capacity, so which is usually prescribed by urologists. So in the end, I would say that urinary incontinence or urinary leakage is a treatable medical condition, and no lady needs to suffer in silence thinking that it cannot be treated. So the best thing is to meet your urologist, discuss the problem with him or her, and try to figure out the solution. Thank you.